Do you know what to say when you visit a doctor in English? Many English learners find it difficult to describe their symptoms or understand what the doctor says. In this lesson, you will practice real English you can use at a clinic or hospital. You will learn how to explain your health problems clearly, how to answer the doctor's questions, and how to understand advice about medicine or treatment. Listen carefully, repeat the sentences, and imagine you are really at the doctor's office. When you go to see a doctor, the conversation usually begins at the reception desk. The receptionist greets you and asks a few basic questions. For example, they might say, "Good morning. How can I help you?" Or, "Do you have an appointment today?" You can answer, "Yes, I have an appointment with Dr. Smith at 10 a.m." Or, if you don't have one, you can say, "No, I don't. I would like to see a doctor, please." It's always good to be polite and calm, even if you don't feel well. After that, the receptionist might ask for your name and some information. For example, "What's your full name?" "Can I have your ID, please?" "Do you have health insurance?" You can reply simply, "My name is Maria Lopez. Here's my ID." Or, "Yes, I have insurance." Or, "No, I don't have insurance." Speaking slowly and clearly helps the receptionist understand you easily. Then, you might wait for a few minutes before the nurse calls your name. The nurse usually takes you to a small room to check your basic health information, such as your temperature, blood pressure, or weight. The nurse may say, "Please step on the scale," or, "Can you roll up your sleeve? I need to check your blood pressure." You can answer, "Sure," or "Of course." These short and polite replies sound natural and friendly. While you wait for the doctor, it's normal to feel nervous, especially if you're not feeling well or if English isn't your first language. Don't worry. Most doctors and nurses speak slowly and clearly if you ask them to. You can say, "Could you please speak a little slower?" Or, "I'm learning English. Can you explain that again, please?" This is completely fine and very common. Here's a small story to help you understand better. Imagine you are Alex and you feel a bad pain in your stomach. You go to the clinic. At the reception, you say, "Hello, I'd like to see a doctor. I have a stomachache." The receptionist smiles and asks, "Do you have an appointment?" You say, "No, not yet." She replies, "That's okay. Please take a seat. The doctor will see you soon." You sit down and wait. A few minutes later, the nurse calls your name. She checks your temperature and blood pressure and then takes you to the doctor's office. Now, the doctor walks into the room and greets you. Usually, the doctor starts with something friendly to help you feel comfortable. They might say, "Hello, how are you today?" Or, "Good morning. What brings you in?" This is your chance to explain what's wrong. You don't need to use complicated words. Just be clear and simple. For example, you can say, "I have a headache. My stomach hurts." Or, "I've been coughing for 3 days." If you want to give more detail, you can say, "I've had a sore throat since Monday," or "I feel dizzy when I stand up." Doctors appreciate when patients explain how long they've had the problem and how strong the pain is. You can use words like mild, moderate, or severe. For example, "The pain is mild," or "The pain is very strong." The doctor will probably ask some follow-up questions to understand your symptoms better. Common questions include, how long have you had this problem? Do you have a fever? Have you taken any medicine? Are you allergic to anything? You can answer simply. For example, "I've had this pain for 2 days," or "Yes, I have a fever at night." If you don't understand a question, it's perfectly okay to ask for help. You can say, "Sorry, could you repeat that?" Or, "I don't understand the word allergic. What does it mean?" Remember, asking questions shows you want to learn and communicate well. Let's go back to our story about Alex. The doctor sits down and says, "Hi, Alex. I'm Dr. Green. What seems to be the problem?" Alex says, "I have a pain in my stomach. It started yesterday after lunch." The doctor nods and asks, "Do you feel nauseous? Have you vomited?" Alex replies, "Yes, I vomited once last night." The doctor writes some notes and continues, "Do you have a fever?" Alex shakes his head. "No, I don't think so." The doctor then gently presses on Alex's stomach and asks, "Does it hurt here?" Alex says, "A little." The doctor says, "Okay, it might be something you ate. We'll do a quick check." After the doctor listens to your symptoms and asks questions, they often begin the examination. This is when the doctor checks your body to understand more about your health problem. The doctor might use a stethoscope to listen to your heart or lungs, check your throat with a small light, or gently press your stomach to see where it hurts. During this time, it's important to stay calm and listen to the doctor's instructions carefully. For example, the doctor might say, "Please take a deep breath," or "Open your mouth and say, 'Ah.'" You can follow these instructions and reply politely, saying, "Okay," or "Sure." If you feel uncomfortable, you can also tell the doctor. For instance, "That hurts a little," or "I feel dizzy when I stand up." Doctors need this information to understand what's happening in your body. Sometimes, the doctor may want to check your temperature, blood pressure, or heartbeat again. They might say, "I'll check your pulse," or "Let me take your temperature." These are all normal parts of a medical checkup. The doctor may also ask if you've eaten recently, or if you've taken any medicine. You can answer, "Yes, I took pain medicine this morning," or "No, I haven't eaten since breakfast." Let's continue with Alex's story. Dr. Green listens to Alex's heartbeat and says, "Please take a deep breath. Now breathe out." Then he checks Alex's stomach and asks, "Does this hurt?" Alex says, "Yes, a little bit." The doctor nods and says, "Okay, I think it's just a mild stomach infection, but I want to make sure." He writes a few notes and adds, "We might need to do a simple test to be certain." In many cases, the doctor might suggest doing a test or examination. They may say things like, "I'd like to do a blood test," or "We'll need to take an X-ray." Don't worry if you don't understand everything at first. You can always ask, "Can you please explain what that test is for?" Or, "Is it painful?" Or, "How long will it take?" These are useful and polite questions that show you want to understand. The doctor might also give you immediate advice. For example, drink lots of water, get plenty of rest, or avoid spicy food for a few days. If you're not sure about something, repeat it to confirm. You can say, "So, I should drink more water and rest, right?" This helps you make sure you understood the doctor's advice correctly. During this stage, remember that body language is also important. Smile, nod, and make eye contact when appropriate. These small gestures show that you're listening and make communication easier, even if your English isn't perfect. After the examination, the doctor usually starts explaining what they think is causing the problem and how you can treat it. This part is called the diagnosis and treatment plan. It's very important to listen carefully because this is when the doctor tells you what's wrong, what medicine you need, and what steps you should follow to recover. The doctor might begin by saying something like, "It looks like you have a mild infection," or "You might have the flu," or "It seems to be a stomach virus." The word "seems" or "might" is often used because sometimes doctors are not completely sure until tests confirm it. After that, they explain what to do next. "I'll give you a prescription for antibiotics," or "You should rest for a few days and drink a lot of fluids." If you don't understand something, you can always ask the doctor to repeat or explain it in a simpler way. You can say, "Sorry, can you please explain that again?" Or, "What does that mean?" For example, if the doctor says you need to take this medicine twice a day after meals, you can repeat, "Twice a day after meals," right? This not only helps you confirm the instructions, but also shows that you are listening carefully. Let's continue with Alex's story. Dr. Green says, "Alex, it looks like you have a mild stomach infection. It's not serious, but you need to be careful with what you eat." Alex listens closely as the doctor continues. "I'll give you some medicine to help with the pain and stop the nausea. Take 1 tablet after breakfast and 1 after dinner for 3 days. Also, avoid fried or spicy food." Alex repeats, "1 tablet after breakfast and dinner for 3 days and no spicy food." "Got it." The doctor smiles and says, "Exactly. You should feel better soon." Doctors often give extra advice about lifestyle or habits, too. For example, they might say, "Get enough sleep. Try to eat more fruits and vegetables," or "Exercise regularly." These tips help you stay healthy, even after you recover. Sometimes the doctor might recommend further tests or another visit. For instance, "I'd like to see you again next week to check your progress." Or, "Please come back if your symptoms get worse." These are polite and clear ways to show you should return if you don't feel better. It's also good to know how to talk about medicine. The doctor might say, "Take this pill once in the morning. Use this cream
twice a day. Take this syrup before you go to bed. When you reply, you can say, "Okay, I'll do that." Or, "Should I take it with food?" Or, "What time should I take the next dose?" Asking these small questions helps prevent mistakes.
Before leaving the doctor's office, make sure you understand everything. You can say, "So, just to make sure, I take this medicine twice a day for 3 days, avoid spicy food, and rest," right? The doctor will confirm or correct you if needed. This small step helps you remember instructions clearly when you get home. At the end of the visit, most doctors will say something encouraging, like, "Take care," or "Get well soon." You can smile and say, "Thank you, doctor," or "Thanks for your help." These polite words make the conversation friendly and natural. After leaving the doctor's office, your visit isn't completely finished yet. The final part usually happens at the pharmacy or when you go home to take care of yourself. This stage is about following the doctor's advice correctly, taking your medicine the right way, and knowing what to do if you don't feel better. It's an important part of the English conversation around health and doctor visits because you may need to talk with a pharmacist or explain your situation to a family member, friend, or even your boss if you need to take time off.
Let's continue with Alex's story. After the appointment, Alex goes to the pharmacy with his prescription. The pharmacist smiles and says, "Hi, how can I help you?" Alex replies, "Hi, I'd like to get this medicine, please." The pharmacist looks at the paper and prepares the medicine. Then she explains, "You need to take 1 tablet after breakfast and 1 after dinner for 3 days." Alex listens carefully and says, "Okay, after breakfast and dinner for 3 days." The pharmacist adds, "Remember to drink a lot of water and don't skip meals." Alex nods and says, "Thank you very much." At the pharmacy, it's common for the pharmacist to ask, "Have you taken this medicine before?" Or, "Do you have any allergies?" You can answer, "No, it's my first time," or, "Yes, I'm allergic to penicillin." If you're not sure how to take a medicine, don't hesitate to ask. You can say, "Should I take it with water?" Or, "Can I take this before eating?" Asking questions shows responsibility and helps you stay safe. When you get home, follow the doctor's advice exactly. Take your medicine on time, rest if needed, and avoid things the doctor told you to stay away from, like certain foods or heavy exercise. If your symptoms start to get better, that's great. But if they get worse or new symptoms appear, you should contact the clinic again. You can say, "Hello, I saw Dr. Green 2 days ago, but I'm still not feeling well. What should I do?" This is a polite and clear way to explain your situation.
If you need to tell your boss or teacher why you missed work or school, you can use simple sentences like, "I wasn't feeling well, so I visited a doctor." Or, "The doctor told me to rest for 2 days." These short explanations sound natural and polite. In the next few days, Alex follows the instructions carefully. He takes his medicine, drinks lots of water, and eats light food. After 3 days, he feels much better. He goes back to work and tells his friend, "I had a stomach infection, but the doctor helped me, and I'm fine now." This shows the full process of a doctor visit, from explaining your symptoms to following the treatment. Every step helps you practice real English you can use in daily life. Visiting a doctor can be stressful, especially in another language, but with simple and polite communication, you can handle it confidently. The next time you need to talk about health in English, remember these useful phrases. I'm not feeling well. I'd like to see a doctor, please. I have a headache, sore throat, stomachache. How should I take this medicine? Thank you, doctor. I'll follow your advice. Learning these simple expressions and practicing them regularly will make you more comfortable in real situations. Understanding and describing your health in English is not just about words, it's about confidence. And with practice, you'll be ready to take care of yourself and communicate clearly wherever you go.